The Biden administration announced plans, as we reported yesterday, to lift the COVID-19 national and public health emergencies on May 11th.
It is a formal acknowledgement that the pandemic has shifted to a new phase, but it also marks the end of certain benefits tied to the emergency declaration. Dr. Frank McGeorge is here with a closer look with what that means for all of us, Frank.
Well, you know, Kim and Evan, of course, to be clear, COVID does remain a concern. We still have more than 500 Americans on average dying each day from the virus. But this change will transition the U.S. to treating COVID as we do other health threats. That means many of the things that have been free of charge for all Americans won't be any longer.
Once the public health emergency ends, COVID tests, treatments, and vaccines will no longer be provided free of charge to everyone. Right now, people with private health insurance or Medicare are eligible for 8 free COVID home tests per person on your insurance per month. We showed you how to claim those tests by requesting them at the pharmacy counter. The pharmacist will enter your health insurance info and run the order through at no cost to you. Now, once the emergency declaration ends, many Americans will likely have to pay out of pocket for those tests. So it's worth stocking up on your 8 free tests per month right now and each month until May. Now, vaccine coverage will also be affected. The shots will largely still be covered for people with private insurance, Medicare, or Medicaid, but those without insurance may end up paying for the shots, which are expected to cost between $110 and $130 a dose. COVID treatments like Paxlovid will also be impacted, with the price to be set by the manufacturer and coverage to depend on your insurance. All of the changes are expected to hit uninsured Americans the hardest in terms of price and access, but most Americans will feel the change through additional restrictions, changes in coverage, copays, or in-network requirements.
So the bottom line here is if you have insurance, it's certainly worthwhile to stock up on at-home COVID tests while they are still covered. And if you're uninsured and due for a booster, here's another reason to go ahead and get that shot now.
Yeah, and there's been some talk that there is a chance that these changes could come a little sooner than May 11th, right?
Yeah, there actually is. In fact, Republicans are pushing to end the public health emergency immediately. Now, there is a vote scheduled in the House this week on a bill to that effect. The Biden administration, of course, has argued against such an abrupt end, but obviously the political wrangling on COVID is just not over. So we're going to have to just wait and see what happens on Capitol Hill.
It's an argument for ordering the tests if you want them free now.
Oh,
right?
yeah. Everything is going to become very expensive with COVID very soon.